Hi everyone, my name is Jonah. I'm an esthetician here at Advanced Dermatology and at Skinfo, and it is my pleasure to introduce Dr. Taub for tonight's webinar.
And I am going to introduce the fabulous Dr. Fabi. That's why she has that name. It means Fabi is short for fabulous. We're colleagues. We're both board certified dermatologists. And I have to say, I think we're both pretty creative in our own rights. And we're not going to bore you with our long list of, you know, academic accomplishments. But we're going to kind of get right to it. So Dr. Fabi and her husband and partner in crime, Dr. Stephen Dayan, have created a whole new skincare product line that is really unique in that it could potentially enhance your mood. So they're calling it a mood ceutical. So it's not just for lines, brown spots, etc., but something that could actually make you feel better and even maybe have people respond to you in a more positive fashion. So let me ask you, Dr. Fabi, how in the world did you and Steve come up with this idea?
Hi. Thank you, Amy. Thank you for actually, I want to just say thank you to you for believing in our product, believing in us, and for thinking of putting something like this together. So I want to thank everyone who joined us. I think there was like over 90 that registered, and it's nice to be with everyone today. So just like we're in this space in the end of the day in cosmetic dermatology. I've been practicing now for 15 years. And something that I kind of noticed time and time again, and just in pillow talk with Steve, is like, why do people really come to see us? Even the most beautiful people that, mathematically meet all like the formulas, sometimes we notice that they're not necessarily happy with what we do for them in the end. And that translates into us not necessarily feeling fulfilled from what we do. So if we kind of take a couple of leaps forward, I think that if you psychologically get back to like why people really get or come to see us, it's because they want to feel better, right? They want to feel more beautiful. Um, in the end, it's not about the collagen or elastin. If that translates to a result, even then, it doesn't necessarily equate to them feeling more attractive or more confident. So we just try to jump a step ahead to really be able to get to the end result that patients really come to our practices every single day for, which is to feel more attractive, to feel more confident and feel more beautiful. So that was what the goal was in that we had in mind. And so then, doing a lot of research just like you do, we started thinking like, well, what gets you to that endpoint? And at the time, it was interesting because I ended up getting pregnant as we were doing some of this work. There had been a little bit of stuff, actually, one paper that was in, I don't know if it was like in Derm Times, looking at oxytocin, topical effects of increasing oxytocin. And Steve and I started thinking about that. Like, people say that you look, would comment to me like, oh, you look so pretty when you're in love, right? And so we're like, we're surprised that no one has thought of this, right? Like, there's oxytocin that you can get in like nasal sprays, but we didn't want to go the drug route. We wanted to go like, is there something like many things in dermatology where you can apply it and it can increase the uptake of something that we naturally make already in our body? And luckily, oxytocin is something that keratinocytes and fibroblasts, which are cells that reside within the top layer and the second layer of the skin, for those who aren't medically inclined listening today, that those cells already make. Could we basically lead the body to make them or increase their secretion just like we get when we're in love? And we were able to come up with a formulation that did just that.
Mm, kind of like also the pregnancy glow. That's what they say,
Right, the pregnancy glow, and so it was like the irony of it, right, was that I wasn't able to get pregnant for like 8 years on my own. Um, all of a sudden I think that I can't get pregnant, and then I get pregnant while we're working on this. I
Um,
didn't do IVF. I just happened to get pregnant. So it's funny how life works, but
but
that's
you
a
weren't using
that's
a
a topic of
product,
a
were
different
you?
webinar. We were
Were,
formulating at the time. We were
okay.
not, we didn't, I did not have it formulated yet.
All right. So let's talk a little bit about oxytocin. What does that do for us? And tell people a little bit about what oxytocin usually is released by, what kind of situations we're in when that particular chemical comes about in our body.
So oxytocin is released in our brain, but interestingly enough, it's also released in our skin. It's released when we have when we feel love, but specifically when we touch with one another, right? Like when we have a prolonged hug, um, released when we're pregnant, and it just keeps going up while we're pregnant, and it's associated with the glow that we get when we're pregnant. Eventually, it's actually associated with uterine contractions when it's at very high levels, which is why during the course of one's pregnancy, at the very end, you finally have birth or give birth.
Mm.
And so it's a hormone that is secreted at the level of both the brain and the skin. At the level of the skin, it's associated, what releases it are keratinocytes as well as fibroblasts. And these are cells that are involved in fibroblasts specifically. We always are trying to find ways to tell our fibroblasts to become
Produce
more
more
active
collagen and
because
all that.
they create collagen, right? They create elastin. Collagen is what makes our skin thick. Elastin is what makes our skin recoil back and have a more youthful firmness to it, right? It also is fibroblasts are responsible for making the proteoglycans and glycosaminoglycans like hyaluronic acid, which we all love. Um, so instead of just tricking fibroblasts, it's like responsible for something that creates the homeostasis in our skin to work better, right? It also has been thought to increase um, it's our natural body's antioxidant. So it decreases the inflammation at the level of the skin. It's our own body's antioxidant. So instead of having to apply, let's say, topical vitamin C, in this case, you're tricking your body to create something that already would create an anti-inflammatory, antioxidant
But
effect.
there's also situations in everybody's life where, for instance, looking at somebody lovingly, or even looking at your dog lovingly, or petting your dog, or looking at your baby, or nursing. Those are all things that are known to release oxytocin. And for anybody who's a mother who's nursed, you have to get into a really calm state in order to be able to nurse. And I noticed because I just had a grandchild that, and like the other day, they were like yesterday, do you want to put him on your chest? And I'm like, are you kidding me? So they give it to me, and it's like I'm having a hard time staying awake because it's so calming to look
So
at his
relaxing.
face.
Yes.
Oh my God. And I'm sure I was just like, firing at all ends with the oxytocin. So it's kind of like the love hormone, right? People talk about feel good hormones, but this one's really the love hormone. So let's talk a little bit about one last thing that's a little bit scientific before we get to the actual
Yeah.
results, which is you also put into this product carob. Also, by the way, the oxytocin comes from the flower jasmine,
Yes.
and the carob, which isn't that something in like chocolate?
It is. And so
Okay.
Kara, so this was something that Steve was a little bit, I was more for the oxytocin. I mean, we both love oxytocin. And there's a lot of science. Even like there's one study where they knocked down the oxytocin receptor and it increased reactive oxygen species and it decreased glutathione levels. So it really underscores the role of oxytocin as an antioxidant, right? Because that's what we're trying to do. We're trying to minimize reactive oxygen species and increase glutathione levels. Shoot, I even do like IV glutathione infusions for its antioxidant effect. And so this plays a role in the skin barrier integrity, right? And then obviously all the other things that come from just the feeling of oxytocin and when you're in love. But Steve, he's written a book. He's a New York Times bestseller on attraction. What makes someone really attractive? Is it again somebody who's perfect, someone who's physically perfect, or are there other things that make people attractive? So he's always been someone who really is obsessed with the science of attraction, as we all are, right? Because we do all of these things in our practice to make people perfect, and even then sometimes they're not necessarily happy, or are they necessarily the most attractive person in the room? So carob is something that is able to increase isobutyric acid. And isobutyric acid has been found to potentially increase our pheromone levels that can make us more attractive. And so this blend of jasmine, a phytopeptide that comes from jasmine, as well as isobutyric acid, is, I think, our secret recipe when it comes to the oxytocin-like effects that we're having at the level of the skin.
Well, let's talk a little bit about the study you did. You had 40 patients,
Yes.
women,
And
mainly studied
yeah,
women, even though you could, if the men are in the audience, you could use this. But it hasn't really been studied on men. And, it got to a statistical significance, which means that mathematically it is more than just potentially chance for people who are listening, but also they did have what we call a control group. So we
yeah,
aren't just saying, oh, it increased it, but they also looked at another group that used some skincare products but didn't have the active ingredients in it. And they found that those people didn't really have any changes. But the people who did use this product for 4 weeks, it was 4 week data and 8 week data, but at 4 weeks, they had all the things that you hear about with, you can hear a commercial, like it
yeah.
even smoothness, radiance, which means light that comes out of the skin, dewiness, reduced redness, reduced dryness, all those things were really important. And I don't mean to poo-poo that, but there are many things that we can use to do those. However,
Right.
it's so exciting that we also got people, so they also looked at your first impression. Now, this is something that Steve Dayan's been like reading and writing about for many, many years. We size people up. He might be able to jump in like a split second. I don't know,
10
it's
seconds. Yeah.
10 seconds. So when you meet somebody, you're not thinking about it consciously, but you all of a sudden decide, do you like them? Are they attractive? How old are they? Do you want to see them anymore? Etc. Okay. And that
Mm-hmm.
first impression, okay, don't judge a book by its cover. Sure, that's true. But let's face it, everybody does, because you're not always going to be in a position to get to know that person. If they've already decided they don't want to get to know you, then you might not be able to overcome that impression.
Yes.
So they asked 239 blinded evaluators. What that means is they didn't know who was treated and who wasn't. And these were not professional people. These were your average people. And they asked them, what is your first impression of this person? And they gave them specific metrics. For instance, how are they with social skills? How are they with their occupational success? Are they attractive? Are they financially well off? Are they good with relationships? And what they found was that the people who had been using the products were rated in all these categories much more highly than the people who were using the placebo, which was really incredible, and also more highly than versus their picture from before they used the product. Is that correct?
Yes. I mean, it was so powerful, Amy, that after just 4 weeks of using it, those that were on the active were rated to be more successfully academically, in dating situations, socially, occupationally, and even more attractive. Just after 4 weeks, zero of the placebo users rated better in first impressions after being on the topical for 4 weeks. And this is 239 random people. They were never showed an image side by side. So it was just, how does this person rate? And we've done this, Steve and I have done this for very similar structures for people after injectable usage. We know that the injectable is going to have this significant effect on first impression, right? So it was quite powerful to see that a topical did this And that in the placebo group, where people had no idea, they don't know what a study is, they don't know, you know, what these people had made a zero impression in all of those
Now,
categories.
let's get down to the really juicy stuff.
Yes.
Okay? The really juicy stuff is that this product could actually make your sex life better. Oh my God. Somebody was asking me today when I was talking to
Now
him,
that was all Steve, and that was his whole push
how
for the
can a
carrot.
skincare product, I think my husband asked me when I was telling him about it, how can a skincare product actually do that? Because does it really go into your bloodstream or whatever? So here
It
is a
doesn't have to.
list of
It
some of the
doesn't have that, which I want to just touch on real quick, Amy. Sorry to interrupt. It
Okay.
doesn't have to, because oxytocin is one of those neuropeptides that positive, like a positive signaling in the skin will increase it has a positive feedback in secretion at the level of the brain. So
Okay.
it doesn't have to be in your
So it's like a
bloodstream
party.
to have
You get more in
the
your
effect.
skin and then all of a sudden your brain just
There's a
like
positive feedback mechanism that exists. Yes.
not.
And that's published in the literature.
Okay, so this is some of the things that they found were statistically significant in the patients after they used it for 4 weeks and weren't significant before they used it. They had a better sexual arousal. They had better orgasms. They were able to let go and surrender to sexual pleasure during sex better. They felt that they sexually reacted to their partner better. They felt the more frequent orgasms. They felt their partner was emotionally opening up during sex more than before. And they felt that their partner was initiating sex more often. And also, they felt like it brought out their partner's sexual creativity, whatever that means. I'm not going to go into that one.
That's a different webinar.
A variety of sexual activities and the frequency of sexual activity. So the bottom line is if you don't want to have more sex, do not use a skincare product. But if you want your sex to be better and you want to make even your partner feel like it's better, then maybe there's really something to this product, which is really, this is something, we never even, I don't think anybody ever even conceptualized that a skincare product applied to your face now, we're not talking about applying it to your genitals, could actually increase some of these parameters. And do you really think that that's all from the pheromone, or do you think it's a combination of the pheromone and
I think
the
it's a combination. I think it's the combination that basically increase the oxytocin. And that's why we've even patented the technology called OX factor. Because Amy, the key thing in what you just said is that 0 of the placebo had any improvement in all the categories that you mentioned, in the 0 out of the 20 categories that you mentioned, versus those that were on the active, which we call it, or in this case, XOMD,
and
where they were positive in 18 out of the 20 categories.
by the way, we want you to know that the people who got the product didn't know whether they had the active or the placebo.
Right. They were in like,
Nobody knew.
nobody knew.
So that's called a double-blind study. That's considered like, the pinnacle of when you do research in science, how you can really tell. Because if you knew that you were using the product, there could be a placebo effect because we know there's like a strong mind-body connection. So you're thinking, oh, this product is making me look, better and making me feel better and should make my partner be more, aroused and satisfied with me. But no, there was no such thing because nobody knew what they were getting.
They didn't
It's
even
very
know.
objective.
And then to add to that, right, like the investigator doesn't know. And then they were all like, they got product that looked the same 4 weeks later, and then they did experience
Right.
these. But I thought what was so interesting, and you run trials too, 2 people got pregnant out of the 20 that were in the active after just 4 weeks of being on the product, right? Which is like,
And they were on birth control too.
right. You have to be on birth control.
That might not be, I hate to tell you this, Sabrina, but that might not be a good thing.
I-
People are gonna be like, I don't want to get pregnant while I'm using this product.
Yeah,
Oh,
I mean, just the power of it, I guess, to like look that much more attractive, desirable, enough so that you're desired by your partner and you engage in maybe
but
that.
also maybe it's the oxytocin, I would think, because, you've always heard that story about somebody who could never get pregnant, and then they adopted a kid, and then the next second they got pregnant. You have to think that maybe there's like something like emotional there. You can't really know what it is, but the
Yes,
oxytocin, since it does a lot of what was said in you know, those 20 features that you asked about were, how do you feel about sex? Do you feel more open and sensual, which, we're so busy. We all know that it's hard to find time to do anything, and then to really be able to relax enough time to have, a good sexual encounter with your husband or whoever it is. It's not always that easy. So maybe that has something to do with how people get pregnant. There's so much we don't know.
there's so, I mean, just because we can't measure it or
Right. We can't
quantify it
measure it
doesn't
yet, but
mean
we will be able to
one
someday.
day we will. Doesn't mean that it doesn't exist. Doesn't mean that there's something that we just don't know that's happening, right? That's with much in medicine. I think that that's what is always what makes me most curious. That's probably what Steve and I stay up at night, thinking about, the things that we can't measure, but we all kind of know that are there, right?
Right.
Um, and so it's like that sixth sense, Steve and I actually one time published on, and this was his idea. It was like, can the blind detect beauty, right?
Mhm.
Like, what is it that makes you, and in fact, we found out that they could, like
Wow.
it's this obsession with like trying to understand like the hidden details in what we do every single day. Because I think
Right.
perhaps if we could, then we can feel through our skin is what Steve says, right? Because it's like another emotional organ. So it's like if you could, if we can tap into these things, then perhaps we can do a service, a greater service to our patients, because really that's what they're coming in for at the end of the day. It's not like effacing their nasolabial fold, right? It's what they perceive doing that is going to offer them or make them feel.
Right. So one more question I have,
Yes.
because my patients are going to ask me, I know, like the minute I start talking to them about this product, they're going to be asking me, well, how does that fit in with my other skincare products? And I kind of think of it as like an enhancement,
Yes.
not necessarily a replacement. Now that could, it's also, I've been using it since I got it. And I have to say that the products are very easy to use. They're very lovely. They're very light. It doesn't take a lot. They're easy to layer, so I've been layering other things over them. So I could see, except for the financial piece where you have now even more products, but
Right.
still, like I could see how it would fit in because I have a certain scheme with my patients. I call it the core four, but it's you know, it's the sunscreen, it's the antioxidant, it's growth factors, and it's something exfoliating. So we still probably need all of those, although maybe because of the anti-inflammatory, maybe we wouldn't need the
Accident effect. Yeah.
antioxidant piece as much. But I did notice that, for instance, it didn't really help that much. Your product didn't really help that much with wrinkles, so we're not going to really be able to get rid of our
Right.
growth
Still want
factors.
your growth factors.
Right.
And you still
So,
want your tretinoin. Like this is not a substitute for this. I completely agree with you, Amy. It's, it adds on, right? I mean, the moisturizer you can substitute for whatever you're using if it works. I intentionally,
moisturizer is so elegant. It's
yeah,
like
and I
so
have
thin, but really
eczema,
moist.
I have acne, right? There's a reason why I'm a derm, right? And I have rosacea. And I can tell you that there's no fragrance in it. We verified it with like an environmental agency as well, that check, to make sure that the ingredients in it are not hormone disruptors. There's like a range from 1 to 10, um, that do not like fall above 4 in like hormone
Right.
disruption or
So
in
no toxicity.
hallucinogenic, right? So intentionally clean, because it's like that's the last thing, it's like the plastic that I take my carry out or get my DoorDash from is already, that black plastic is already, a problem
Right.
enough. It's like there's so many things that we come into contact with. Our skin's our biggest organ. the last thing we want is to be adding, more to what we're exposed to. So that was intentional to not add to like the exposomes that we're already exposed to with the other things that this resides in. And so the moisturizer, excellent. Especially during the day, you can easily add on to it. You can put your makeup on. I get glammed up for things all the time and it's a non-issue. It's elegant to layer on. The serum in the trial, we did use both twice a day to get the results that we got, but you could easily use it as to like replace whatever that antioxidant step is at night. And we did find that it significantly improved redness. You would expect it to, if it's your body's natural antioxidant, that you would see improvement in redness. And that was one of the key things that we saw in the trial. So it does, because of its anti-inflammatory, antioxidant effect, it's something you can replace, you can kind of use in whatever that step would be at night if you wanted to, not, substitute for your antioxidant in the morning.
Good. So we don't have to like, you know, use every single product. It's always good to like, be a
Yeah,
little
to kind of know
frugal.
where, if you want something heavier as a moisturizer at night, because you're perimenopausal, menopausal, definitely, something that's like richer in ceramides. But if you're not, like if you're in your 20s, 30s, and early 40s, excellent to use morning and night. Because somebody's asking us, Amy, right now, what if you are in menopause and taking HRT? Will the product still work? In the trial, we didn't exclude folks that were in menopause. So it wouldn't, there's no reason,
But
there's
if
no.
they had gotten pregnant, then you would have had an incredible finding. No, I'm just kidding. Yeah, well, when you're
Like a
in your
divine, that would become a divine intervention, and that would be a completely different category.
but women in menopause have oxytocin. So, it's not like you can't enhance how you feel about yourself just because you don't have estrogen. That
Right. This
and
is so
people
important.
still have sexual feelings
And
and
and then with that, Amy, like there's no reason, like people that are in their 60s or 70s, I have patients that are in love more than ever, and their second or third, love of their life because of whatever has happened in their past, or
but
they
not in their first love.
they're or
After
they're in
30
their
years,
first
you get
love
a
and
little
they still
toxic.
love, they're still quite in love with their partners. So there's no love, there's no age discrimination when it comes to love.
Right. But if you're like what she said before was like if your skin is super, super dry, you could use another moisturizer laying
Yes,
over it.
especially at
I mean,
night. Yes.
and you could even use like a moisturizer that doesn't have actives in it, that's not expensive to
Right.
get that piece.
Right. And then you can use this instead for your serum part. And that's completely appropriate if you want to still get that effect.
Because a lot of times when I tell people to do when we have a new product line like this, it's like use it. Well, since you showed that it only takes 4 weeks to work, use it twice a day for those 4 weeks, both of them. And
Yes.
then maybe you could use it once a day, both of them. And then that means you have, to maintain, to continue.
Yes.
It's another way you could do it, even though that wasn't studied. Although you did find that there was continued improvement after from 4 weeks to 8 weeks.
Right. Like it got better. And so like, what do we know from like skincare clinical trials? Usually if you stay on the things, you get better. Obviously we have to design it to optimize. So optimizing is how are we going to get to the results as quickly as possible? So to your point, twice a day is going to like optimize it. But like in reality and like in practical, in a practical
And
setting,
every day,
in an everyday setting, could you theoretically use it, once a day after the 4 weeks, to just keep it going? You could, right? We haven't studied that. We were trying to just, optimize
or
it.
after the 8 weeks to get the maximum, which you've
Exactly.
shown, and then
And then just kind of weave it into your normal skincare routine. Yes.
but it's very easy to use. I actually really, really enjoy using it. So, and at this point in my life with all these different products that I have access to, I want a product that works, but I also want a product that like I actually enjoy putting on because after all, it's like a time to myself. I sit down, it's like the quote unquote self-care, and I put my creams on and it feels good. And if it doesn't feel good to put it on, I just won't do it because there's always something else around the corner. But yours definitely feels very good. Feels very
And
elegant.
so something about me is that I have like a little OCD about things looking like perfect, right? Whether it's my home or the way that I dress, I'm very like sensitive to this. And so I wanted it to look good on your counter.
I
So I
absolutely,
almost
you have
drove
it.
Steve
I
nuts.
absolutely love the packaging. The packaging is so brilliant. In fact,
Yes.
I'm changing my whole countertop because I decided they look like statues. So now I'm going to rearrange everything that's on my counter around it so that it looks more aesthetically pleasing. So in the morning when I go to put on my things, it's going to be like I get that much more enjoyment out of it.
Right. I'm like putting them there, but like
It's
they
so cool.
actually they're super neutral because my like our home in San Diego is like I try to keep it extremely um
Sometimes I stack the ball on top of the
you
X.
can,
That's cool
you do
looking.
that too.
I like,
So yeah, it's I just like this monochromatic, super clean look. That's how my bathrooms are designed. So I wanted something to look good and
yeah, it's actually,
yeah,
they're easy to open and use too.
yeah.
So anyway, that's my little testimonial.
Yes. Thank you. Thank you,
So,
Amy. And
do we have
thank you
any
for
other
all the questions.
questions?
I think there was one more of somebody who said that they have rosacea and that they're like on top of topical ivermectin. Although in the trial we excluded people that actually had like a medical diagnosis of rosacea, we did see that those that had rosacea, because again, I intentionally formulated this for myself too. So I have rosacea, acne, and eczema. And so everyone who had redness, their skin got better.
And Sabrina,
So
I
it's
just have
a
to say that
non-issue.
everybody in the audience is going, sure, she has acne, rosacea, and eczema.
I
She looks
know.
like flawless.
Yeah.
Oh, you don't have a lot of credibility there, but okay.
Well, this stuff, all the stuff we do works, right?
Right.
I'm not saying that all I do is skincare. I think
I
that
was
would be
teasing you.
right. No, but like for those that are listening, I know many of your patients, it's like you've got to do all the things, right? And it's like
Mhm.
people don't have a six pack just because they do crunches. I mean, they have a six pack because they eat a certain way, they go to the
Right.
gym enough, they do a variety of exercises like planks and
Exactly.
so it's like the same as with this. Like this is something that complements our aesthetic practices. If you're doing the photofractional treatments with your lasers and you're doing your toxin, like you're doing all those things, what you put on your face every single day makes as much of a difference.
Well, this was super fun, and I thank you for joining us and telling us about your great breakthroughs. And I'm going to let Jonah wrap it up, and I look forward to we have the products in SkinFo now, and I'm so excited for all of my patients and friends and family to try it, and I wish you great success.
Thank you, Amy. And thank you to everyone who's joined us tonight.
All right. Thank you to everyone for joining the webinar and listening to Drs. Taub and Dr. Fabi talk. The link to the Thruple bundle is on the Skinfo website. So if you have any questions or want to stop by, always feel free to come into Skinfo and ask any of the estheticians on staff. Thanks so much for joining and have a great night.
Bye, everyone. Have a
Thanks.
wonderful evening.
Bye.